Hello everyone. Today we will discuss biliary tract anatomy and primary biliary cholangitis pathology in detail. I'm sorry for my voice. I'm having severe allergies. I hope I'll recover soon. But besides from that, we will still going to cover our topic. This is about anatomy of biliary tract. We will touch on clinical significance of biliary tract along with liver tissue architecture. We will discuss liver tissue anatomy, and we will try to understand lobular bile duct in detail, as well as we will discuss primary biliary cholangitis. In the end, we will test our knowledge with a question. Most of the part of the presentation is from first aid as well as my UWorld notes. So you will going to cover a lot of stuff related to this topic today from first aid and from UWorld. So first of all, let's go through biliary tract anatomy. So you can see that there is a gallbladder that is emptying into cystic duct. There is a common hepatic duct which is coming from the liver, common hepatic duct and cystic duct together emptying into the common bile duct. Common bile duct enters into ampulla of Weber, which is the part of main pancreatic duct. So this is how it is related to pancreas. And next, we can see that how it is related to duodenum when through sphincter of Oddi that secretions enter into the duodenum. This material is covering kind of first aid. So this is the clinical significance of the anatomy we have just seen in the picture. We can see that if there is a gallstones that reach the confluence of the common bile and pancreatic ducts at the ampulla of Weber can block both the common bile and pancreatic ducts. So right here, if we look this part, if there is a gallstone at this part, it can cause cholangitis as well as pancreatitis because it is blocking the way for bile to enter into the GI tract. So, like in entering into the duodenum, this blockage can cause double duct sign, leading to inflammation of gallbladder, that is cholangitis, and inflammation of pancreas, that is pancreatitis. And next there is another clinical significance of the anatomy of biliary tract, that is tumors that arise in the head of the pancreas, usually which are ductal adenocarcinoma, can cause obstruction of common bile duct, resulting in an enlarged gallbladder with painless jaundice, which is a Courvoisier sign. So these are the two main things which you will see in USMLE. So these are the main things which are discussed in the first aid. Next, liver tissue architecture. This is a very nice diagram here to understand the concepts of first aid, because this diagram is not given in first aid. I found it on internet. So by the way, you will see all the references on the last slide from where I got all that information. So we are going to, it is very important to understand liver tissue architecture in order to understand the problems in zone 1 of the hepatocyte, which is a liver cell, the problems in zone 2 and zone 3. As well as this diagram, in addition to that, also give us a very nice picture of anatomy of hepatocyte. It also familiarizes with the location of hepatic artery, portal vein, and bile duct. So the functional unit of the liver is made up of hexagonally arranged lobules. So this is the hexagonally arranged lobule of the liver, surrounding the central vein with the portal triad on the edges. So here is the central vein, and here is the portal triad on the edges. Consisting of portal vein, hepatic artery, bile duct, as well as lymphatics, as I showed you already that there is just removing so that you can see here is the bile duct, portal vein, and hepatic artery. So this is a picture of a hepatocyte, and as well as you can see that in the picture in the down, there is the hepatic stellate cells in a space of Dc that store vitamin A. These are more clear in this section in the space of Dc. And they store vitamin A here and produce extracellular matrix when activated, and it's responsible for hepatic fibrosis. So if you get chance to work in the liver, in the hepatology clinic, you may have seen lots and lots of cases of hepatic fibrosis. That is the scarring of the liver gets hard. Why it's getting hard? Here is the answer. What's going on there? There is vitamin A, which is supposed to store in the disease store or in the hepatic stellate cells. They are producing lots and lots of extracellular matrix, which is leading to hepatic fibrosis when there is an abnormality. Okay, so now we will take a look at the zone 1. So what happened when there is fibrosis? Which conditions causes fibrosis in zone 1 of the liver, which is periportal zone? It is affected first by viral hepatitis, which could be affected by the hepatitis A, B, or C, and it is the best oxygenated area and most resistant to circulatory compromise. And ingested toxins, for example, cocaine, can also impact this area of the zone 1. Then we look at the zone 2, which is the intermediate zone, right here. It got affected with the yellow fever. Yellow fever is caused by a mosquito bite, and there is a jaundice-like symptoms. Zone 3 is affected by pericentral vein, centrilobular zone, as you can see here. It is affected first by ischemia. So it is the least oxygenated area, and there could be high concentration of cytochrome P450, which can impact zone 3. It is most sensitive to metabolic toxins, for example, ethanol, CCl4, and halothane and rifampin. So there are chances that a person who is taking alcohol and he's having scarring, it might affect zone 3. There is cytopholcolic hepatitis too, so it is also cytopholcolic hepatitis. So by knowing these zones, you can figure out the cause of the scarring of the liver. So that's pretty interesting. Next, we will go through the anatomy to understand lobular bile duct. So this diagram is a pretty good diagram. It is very much similar to first aid 1, but it is better than that because it also zoom in the part to see lots of details. If we look at the apical surface of hepatocytes, by the way, hepatocytes are right here. You can see these cuboidal cells. So if this is the line of hepatocyte, and then we can see where are the bile canaliculi. These are in the apical surface of hepatocyte. Then where is the sinusoids? Sinusoids are on here is the sinusoids, the red part. This is the basolateral surface of the hepatocyte. Inside the sinusoid, there are Kupffer cells, which are purple cells, which are specialized macrophages and are located in the sinusoids. Okay, next. It's time for the primary biliary cholangitis, which is an important topic. I've seen questions in UWall about this topic, so it is very important. This material, the pathology part, is from first aid, so you can open your first aid and look into that. But the diagram is not from first aid. I found it on internet and I found it very useful. So pathology of primary biliary cholangitis. Number one, very important part to notice that it is an autoimmune reaction. As a result of an autoimmune reaction, there is lymphocytic infiltration and there is granulomatous inflammation, which causes destruction of lobular bile ducts. Okay, I know it's a lot of information. What's going on exactly here is this. If we zoom in a little, you can see that there is a cholestasis going on. This cholestasis is due to there is a blockage here, and the blockage is because of progressive inflammation, and that inflammation is causing fibrosis, which is a granulomatous type of fibrosis. Here is the better picture to see it. This is the primary biliary cholangitis. It is showing the lymphocytes infiltration, which is leading to duct obliteration and scarring of the liver. You can see there is granulomatous destruction. Due to that destruction and blockage, there is a bile reflux or cholestasis. So this is what's going on in primary biliary cholangitis. Now, after looking into the diagram, I think it makes more sense when we read first aid. That is, there is lymphocytic infiltrate. We understand that. We understand that this is granulomatous type of inflammation. That's why it is granulomas. And we also see that there is destruction of lobular bile ducts. Next, there are additional features which are mentioned in the first aid are on the lab, you will see an anti-mitochondrial antibody. It is very important, and you may see that in the question. There is increased IgM, and since it's an autoimmune disease, so there are more chances. There's a history of other autoimmune diseases in family, like Hashimoto's thyroiditis. There could be rheumatoid arthritis history. There could be celiac disease history, or any other autoimmune disease could be there. Treatment is ursedile. It's pretty commonly used drug for gallbladder disorders, like as it helps in thinning of the mucus, and as it thins up the mucus, it helps the bile to go through tiny space. So that's how it helps in thinning of the bile, and it makes the way smoother for it to go. And first aid also mentions that in the epidemiology section that it classically in middle-aged women. So now we're expecting, if we see a scenario of autoimmune disease in a middle-aged woman who is having symptoms of liver dysfunction like itching and fatigue, we may consider that there is primary biliary cholangitis. But now the cherry on the top are the UL notes here for you. If you go through all these part of the presentation, there is no way you are going to miss that question. So primary biliary cholangitis is an autoimmune liver disease. We already established that. Second is characterized by the destruction of small and mid-sized intrahepatic bile ducts, which causes cholestasis. I believe the diagram that's hexagonal cell hepatocyte, which shows the presence of intrahepatic bile ducts, which is causing cholestasis. This diagram indicates where are the bile duct, where is the location of bile duct, and this diagram explains how cholestasis is going on. Explain this point very clearly, that destruction of small and mid-sized intrahepatic bile ducts causing cholestasis. And the third point is it is associated with other autoimmune disorders. As I mentioned before, there is possibility that patient might having rheumatoid arthritis or any other autoimmune disease like Hashimoto thyroiditis and celiac disease. And the fourth part is the clinical features. What are the clinical features? Patient might have fatigue, itching, and hepatomegaly, the classic liver symptom disorder. because there is inflammation and scarring going on in the liver. Liver is affecting. Next thing is labs. We will see increased alkaline phosphatase. In most of liver diseases, alkaline phosphatase is increased. Second, it is not, you cannot, you can determine with increased alkaline phosphatase that there is a liver problem, but you cannot determine the cause. To determine the exact cause of the liver problem, we have to go further, we have to do further testing. And if we see positive anti-mitochondrial antibody, that means it is definitely primary biliary cholangitis. Next, we can confirm our diagnosis with the biopsy. Like if we see patchy lymphocytic inflammation leads to granulomatous intrahepatic bile duct destruction, then it's definitely primary biliary cholangitis. So what kind of question we will see? We can see a question like that in USMLE or in UWorld, like a 52-year-old woman having 6 months history of fatigue and pruritus, no medicine and surgical history, no intake of tobacco, alcohol, and drugs. Her sister has Sjogren's syndrome. Examination shows skin excoriation, mild hepatomegaly. Another. Alkaline phosphatase is 480 unit per liter, which is raised. Antimitochondrial antibody is positive. In this question, SGOT and SGPT values doesn't matter because we have very much clear indications of what we just read. Pathogenesis of the patient indicates which of the following. Answer is primary biliary cholangitis. So I hope you find this video useful, and if you want to know more about that, here are the references which I used. I used First Aid for the material. I used my UWorld notes, and the images I took from following websites. The links are there. I will add them in description too for you all. Have a nice day. Please subscribe and like to my channel so that I can continue making these videos for you. Thank you.